This is Dr. Vijayabhasker, consultant laparoscopy and GI surgeon at Divya Health Center, Kanjipuram. As the World Hepatitis Day is around, I'm here to create an awareness about hepatitis to all you guys. The hepatitis burden is so high that 1/3 of the people with hepatitis are due to infections. And hepatitis causes so much of morbidity and mortality. And the good thing about this is most of the things are preventable. Preventable if you take adequate measures. And coming to you to make you aware about the symptoms of hepatitis, it's like vague abdominal pain, and there can be a yellowish discoloration of the eyes, and your appetite will be very less, and you will feel nauseated whenever you feel like eating. And even if you try to eat, there will be vomiting, and yeah, there can be, if it persists for a very long time, and there can be fluid collection in your abdomen, that is cholecystitis, and there can be leg swelling too. If these things are not treated adequately, it might lead to chronic liver disease, which is an irreversible damage to the liver, and that might lead to liver dangerous conditions like liver cancer and total liver failure, and which might need liver transplantation also. Hepatitis are mostly due to infections, and there can be metabolic causes like fatty liver which can cause hepatitis, and there are some drugs which can cause hepatitis. Leaving behind that drugs and the hepatitis due to fatty liver, I'm focusing on infections. Infections, the commonest cause for hepatitis is hepatitis B virus and hepatitis C virus. And these things are very much preventable, because these B and C type of viruses spreads via direct contact and spreads via blood and spreads via body fluids. These things can be very much treated if identified early and before any liver disease sets in. And the another next common type of hepatitis is hepatitis A virus, which is very common during the monsoons because it spreads through contaminated water and foods. Okay, it is also very much preventable. The good thing about hepatitis A virus is it is self-resolving, and with correct identification and correct treatment, the morbidity can be much less, and it's a less dangerous virus when compared to B and C type of viruses. And coming to the B and C type of viruses, these things has to be identified early, and we do routine screening during our surgeries, and we pick up many patients without any symptoms. And if we treat them at an appropriate time, and then if we treat them adequately, they will be cured, and the long-term complications like liver failure and liver cancer can be prevented in these kind of patients. And for you, I would like to tell you about do's and don'ts to keep your health, to keep your liver healthy and prevent you from liver diseases. For preventing hepatitis A virus, and you need to be follow very strict food hygiene. That is, you need to avoid eating food from any unhygienic places, and you have to stick to strict dietary, that is hand washing procedures, all those things. And coming to the drinking water, always use boiled cool water, and always try to avoid food from outside places and eat only freshly prepared food. If you do these things correctly, and preferably during the monsoon times, it's better to avoid eating food from outside, because during the monsoons there will be contaminated water everywhere, and there will be spread this kind of viruses will spread through water and food which is not properly cooked, or which is properly not maintained cleanly. Okay. And coming to the B and C type of viruses, these type of viruses tend to spread through blood and blood products. So then other mode of transmission is sexual transmission, and through intimate contact. Like if you want to be safe from infections, try avoiding razors. And for our healthcare professionals, don't try to reuse needles, which we don't do nowadays. And make sure you sterilize all the instrument you use on your patients you sterilize it adequately. And coming to our patients, Don't share things which might have body fluids on it, like shaving razors, all those things. And try to avoid sexual contacts with those patients who I like to tell you about the do's and don'ts to prevent your hepatitis. In the hepatitis A virus, the don'ts are don't eat any outside food during monsoons. Always eat clean food. Always wash your hands thoroughly before eating. Drink only boiled cool water. And you need to do these things every day and on. And whenever when you have symptoms of liver disease like generalized weakness, body pain, nausea, poor appetite, and all those things, or even when your eyes are yellowish, when the urine turns yellow, don't waste time and go to your physician or any clinician directly, and don't take any native medicines without proper workup. This is the do's and don'ts when it comes to the hepatitis A virus. And when it comes to the B and C type of viruses, the don'ts are don't take any native medicines whenever you have any symptoms. Also, don't share any any things which might contain body fluids, blood on them from which is used by the others. Coming to the healthcare professionals, please do not reuse anything which are potentially having which can potentially harbor contaminants or body fluids of some other patients. Always thoroughly sterilize the equipments you use on patients. Okay. And coming to the hepatitis B virus, always get vaccinated. When you are not vaccinated for hepatitis B virus, try to get vaccinated. Go to your physician or go to any doctor, they will and ask about vaccination, they will be able to tell you. And on this World Hepatitis Day, keep your liver safe, and remember, most of the hepatitis is curable and treatable when identified early. So go to your doctor, get your liver checked,